So bone grafting, like in what situation does somebody need a bone graft?
A lot of times maybe in the area they have an area that they need an implant that they just don't have enough bone for. So we're able to build that bone back with various techniques to get them the bone they need to have the implants that they desire.
Okay.
Also, we use it to save teeth. A lot of times teeth through periodontal disease issues have lost bone, and so what we can do is we can actually add bone back to those teeth to strengthen them so they can keep them for a lifetime.
So what's involved? How do you do it? Like how do you give them bone back is what I'm asking.
Okay, so a lot of times what we end up doing is it's a minor surgical procedure where we kind of open the gum, clean out whatever underlying infection is in there, whether it be with lasers or traditional treatment, and then we actually pack a bone graft material.
Like injecting it in, or just kind of laying it in?
It's more like a sand. It's a product that's more like a sand, and we layer it in there, and we usually cover it with some material to hold it in place.
So and the tooth gets stronger because it's held by this bone.
And then what it does is it acts as a scaffolding for your bone to grow in and around. So it actually builds your own bone. And that graft material is usually broken down, and you're left with your own bone back in that area when it's all said and done. Bone is very dynamic, and so bone heals at a very fast rate.
So the procedure, is it painful? What's the downtime like?
No, it's done with usually just typically with local anesthetic. People usually return to work or their activities that day or the next day. Minimal discomfort.